Dr. Anderson, and this is Sasha, our technician, and this is her puppy, Gigi. We are going to go over today what to expect at the veterinarian's office after you get a new puppy. So the first time you come in, you want to try to schedule that visit within 48 hours of getting your puppy. And we're going to review the vaccine records that have come with the puppy from the breeder or shelter to determine what vaccines are needed next. Most of the time, we're going to end up doing a distemper parvo vaccine at the first visit, and sometimes even a bordetella vaccine that protects against kennel cough. The distemper parvo vaccine is one that we will typically do in puppies 3 to 5 times, depending on how young they were when the vaccines got started. The reason we do this is because the mother's immunity is passed on to the puppies, so when they have an immunity from the mom, it can interfere with the vaccine. The problem is, we don't know when the mother's immunity wears off. So at some point, the mother's immunity is going to be out of the puppy system by the age of 16 weeks, but it can happen before that too. So there could be a gap in when they're actually protected against distemper and parvo and when they're not. And since this is such a serious disease, especially parvo and distemper, they're very bad diseases to catch. So that's why we have to be really careful to make sure that we are keeping up with those vaccines every 2 to 4 weeks in a puppy until they are at least 16 weeks old and have had the final vaccine. We'll also deworm your puppy just to be on the safe side, because we don't always see every type of parasite on these fecal tests that we do. We will also discuss getting your pet started on prevention. This is very important. We have to have your pet on heartworm, flea, and tick prevention as early as possible. And we'll help you pick out the one that's the easiest for you to administer and that's the safest based on your pet's weight and age. So the next couple of times you'll come in will be with a technician like Sasha here. And typically what those visits are for are just to keep updating the vaccines. So again, giving distemper parvo vaccines, and most likely starting influenza and leptospirosis. Those are both very important things that we need to vaccinate for that are seen in this area. And then we'll also deworm one more time at that point and just check your puppy over to make sure that there's no problems, that we're still growing and gaining weight normally. And sometimes the techs can also answer any other little questions that you might have. And then the final visit is usually around 16 weeks old, and that's when we're going to make sure all the vaccines are finished up with, including rabies. And at this point, once they're fully vaccinated, that's when they'll be safe to go to dog parks and start socializing more. We also do one more stool test that's a little bit different than the first one that we did, that helps cover another range of parasites that could be in the intestinal tract, and we'll deworm one more time. We'll also discuss with you at that point getting your puppy spayed or neutered, and just make sure again that we're growing normally and we're not having any issues with our coat, that we're on a good diet. So that's our final puppy checkup until basically the next visit, which would be getting your pet spayed or neutered if you choose to do so. We usually recommend, depending on the breed, we do recommend between 6 to 8 months old to go ahead and get your pet fixed. And after that, we're smooth sailing for a little while until it's time for their first annual visit. And at that point, we'll do their next round of adult vaccines. We'll do their first heartworm test. We'll make sure that they're on an appropriate dose of prevention and just check them over to make sure they're still in good health and graduated into adulthood normally.